Hi, my name is Quinton and I'm from Pain-Free Physiotherapy and Allied Health. I'm here to talk to you about the rotator cuff muscles. The rotator cuff muscles include four main muscles. This includes supraspinatus, infraspinatus, teres minor, and subscapularis. And these all work together to help stabilize our shoulder. Now, there are many causes where pain in the front of our shoulder are caused by the rotator cuff muscles. Now, this can occur from trauma or overuse injuries, but most of the time, this is to do with posture, especially people who work long hours sitting down at a desk. Now, there are also people who have rotator cuff injuries or pain that aren't symptomatic, meaning that they don't suffer from the symptoms or they don't show it. But over time, if this isn't assessed and treated, the rotator cuff muscles can actually be further damaged, cause further imbalance in our shoulders, and even cause impingement. So other than pain in our shoulder, people can also report pain with range of motion, like moving around your arm, or muscle weakness, or difficulty with certain movements, such as lifting or pushing things. So what will the doctors say? Most of the time, most doctors will diagnose you with bursitis, tendonitis, tears, or even shoulder impingement. To further support their diagnosis, they may send you to get some form of imaging, such as an X-ray, MRI, or an ultrasound. And then for treatment, your doctor may prescribe you some pain medication, or NSAIDs, which stands for non-steroidal anti-inflammatory drugs. Although your pain will decrease, this only masks the pain, and this doesn't actually solve the problem. Now, your doctor may also prescribe you with some corticosteroid injections to reduce the inflammation or pain. However, corticosteroid injections also had its side effects, and this can make the tendon quite weak and brittle and actually increase the risk of further tears. Now, if the shoulder pain is limiting your day-to-day life and activities, surgery is also an option. But one thing to note, not everyone that has surgery will recover back to 100%. Rotator cuff surgery has a higher failure rate than a success rate, but this also depends on the type and extent of the injury, and also age as a factor. So what do we do differently here at Pain-Free Physio? At Pain-Free, we are experienced at using a holistic approach to assess the body as a whole and to identify all contributing factors that lead to your signs and symptoms. In fact, there is a chance that the area and the structures underneath the painful area in your shoulder aren't the cause of your symptoms. And the common causes that we usually find may be found in other areas such as your neck, the thoracic spine, and your chest, or even down to your calves. So what are some examples of strategies that can help with shoulder pain? Well, this all depends on what we find in the assessment. If we find that one of the muscles in the shoulder, one of the rotator cuffs, infraspinatus, is quite tight, we can teach you a home exercise program to help release that. And all you need is a pocket physio. So firstly, we'll let you know where the muscle is and what we want you to feel. Then put the pocket physio against the wall, and then you want to push your back into that spot. Now, to make sure that you're on the muscle, you can lean side to side as well, and you'll feel quite sore in that area. A lot of the time, posture is the main cause. For an ideal posture, make sure the seat is adjusted so that the desk is at elbow height. Keep your shoulders nice and relaxed, rolled back rather than slouching forward, and don't have your arms outstretched. Lastly, make sure that you're taking regular rest breaks rather than sitting for long periods of time. We recommend that you stand up, have a stretch, or walk around for every 30 minutes. So, if you are following the mainstream ways by your doctor or other physios and you aren't getting the results that you need or want, feel free to come and talk to us, and we'd be happy to answer your questions and tell you what we do differently for your condition.